Okay, magandang umaga po sa ating lahat. I am Assistant Professor Regine at kami po dito sa UPOU ay lubos na nagpapasalamat po na kayo ay mga nakadalo ngayon dito sa ating Let's Talk It Over or LTIO. Gusto kong matulog pero di ko magawa. The importance of sleep for persons, health and well-being at isang mainit na pagbati muli sa ating lahat. So this event is in partnership po with UP Siesta, one of the recognized organization under UPOU. The webinar aims to address the importance of sleep health issues by providing participants with evidence-based information on sleep health, identifying common sleep disorders, and offering a practical strategies to improve sleep quality. So by raising awareness and providing actionable insights, the webinar seeks to empower individuals to take control of their sleep, health, and consequently their overall well-being. So at the end of the webinar, participants must be able to, number one, raise awareness about the importance of sleep and its impact on overall health. So number two, identify common sleep disorders and their symptoms. Three, provide practical tips and strategies to improve sleep quality. Fourth, discuss the role of lifestyle, environment, and psychological factors in sleep health. And then lastly, encourage participants to seek professional help if needed. So we are currently live on-site at the audiovisual room, UPOU headquarters. We are also streaming live via UPOU Networks, the UPOU Facebook page, and YouTube channel. So this event aligns with various Sustainable Development Goals, or SDGs, namely Good Health and Well-Being, which is SDG 3, Quality Education, SDG 4, and Partnerships for the Goals, SDG 17. So this is also part of the intersection of our Public Service, Research, and Instructions Trust, which we call Community Inclusivity, Digital Transformation, and Acceleration Toward Sustainability, or CIDAS, with focus on community health, education, and well-being. Without further ado, let me introduce to you one of the esteemed women behind this initiative for the welcome greetings, none other than our Dean of the Faculty of the Management and Development Studies at the University of the Philippines, Open University, Dr. Joanne V. Serrano.
Thank you, Reg. Isang maalab at mapagpalayang araw sa ating lahat. Indeed, this is a very timely and relevant talk. I'm sure you're attending now here on-site and online because all of you can relate on the importance of sleep. So, iniisip ko nga kanina, nakatulog ba ako gabi? Minsan ganun parang feeling ko hindi ako nakakatulog. Pero pagising ko naman, parang nakatulog naman ako. So, I'm sure our esteemed speaker will shed light on paano ba tayo makatulog ng maayos. Kasi gusto nating matulog, pero hindi natin magawa. Ang dami minsang umiikot sa ating isipan na minsan nakakabagabag sa ating tulog. Let me just share that for those who are attending the Let's Talk It Over series for the first time, the LTIO series has been a platform of knowledge dissemination and community engagement, exemplifying our faculty's dedication in making education open and accessible to everyone. So I would like to welcome everyone. Thank you to our women guests. Sila po yung mga guests din namin kanina sa which I think is very relevant. I was just telling Doc Mai, we had the launching of our lifestyle garden earlier this morning, and I think getting a good night's sleep is also part of our well-being. So pinakita po kanina yung tatlong SDGs, but I think it goes beyond that. Pati po ito dun sa work, it affects everything in our lives, yung sleep po natin. If we do not get enough sleep, pagdating kinabukasan, hindi tayo makapag-perform ng ating trabaho, hindi tayo makapag-interact with our colleagues kasi nga kulang yung ating sleep. So I am very thankful to our program chair, Doc Mai, for kumbaga, naisip niya. At marami pa siyang naisip na mga very relevant talks related to our well-being. Gusto ko lang pong i-highlight na For me, it's very important na for us to function well in the university, in the community, kailangan natin pangalagaan yung ating well-being. And I think nagsisimula ito sa maayos na tulog. Kanina pinag-usapan yung maayos na pagkain, kaakibat po yung maayos na tulog. Kasi without a good night's sleep, lahat po apektado. Alam to sa FMDS, pag kulang ako ng tulog, mainit na ang ulo ko. So lahat din po yun, di ba, nakaka-apekto sa ating lahat sa ating buhay. So yun lang po, I would like to thank everyone and welcome everyone to our LTIO. This is a very relevant topic and there will be more topics like this that we will be offering to our constituents. This is not just for our faculty, staff, and students, but even to our partner communities. Napapakita po yung madaming uma-attend ngayon online at uma-attend dito, nagpapakita ng importansya ng pagtulog sa ating buhay. So yun lang po, maraming salamat and good morning everyone.
Thank you very much, Dean. Totoo po, napaka-importante ng ating pagtulog. So before we begin our presentations, may we kindly remind our participants on site, as well as those streaming online, that you may already begin preparing your questions. Mas maganda pong daming tanong. While listening to the presentations for our on-site participants, we'll be giving you a piece of paper where you can write your questions. You may give this paper to any pleasure to introduce to you our speaker, Dr. Beverly Peralta Carbonell. She is a distinguished otolaryngologist and sleep medicine specialist based in Baguio City, Philippines. So she holds consultancy positions at several hospitals, including Baguio General Hospital and Medical Center, Notre Dame, The Charts Hospital, and Pine City Doctors Hospitals. Dr. Carbonell completed her medical degree at St. Louis University. She holds a diploma in international health from the University of the Philippines Open University and pursued advanced training in sleep medicine at St. Luke's Medical Center and Changgung Memorial Hospital in Taiwan. So as a member of various medical societies, she actively contributes to the field through research and publications. Dr. Carbonell currently serves as treasurer for the Philippine Society of Sleep Medicine and is a member of the Philippine Board of Sleep Medicine. She contributed to numerous research studies, including topics on obstructive sleep apnea and hearing acuity in MDR-TB patients, and is dedicated to advancing the field of sleep medicine and improving patient outcomes. So let's all welcome Dr.
Magandang umaga po sa inyong lahat. Naimbag nga aldaw kada kayo amin. I would like to thank the Faculty of Management and Development Studies of University of the Philippines, UPOU, our Dean, Professor Joanne Serrano, to Ma'am Noreen and the whole team, and of course to my beloved Professor Dr. Myra Oruga for this opportunity. Okay. So, our lecture for today is entitled, Gusto kong matulog pero di ko magawa, the importance of sleep health and well-being in a person. So, this is my disclaimer. And the objectives for this morning's lecture are as follows. Number 1, to raise awareness about the importance of sleep and its impact on overall health, identify common sleep disorders and its symptoms, provide practical tips and strategies to improve sleep quality, discuss the role of lifestyle, environment, and psychological factors in sleep health, and to encourage everyone to seek professional help if needed. So actually, good sleep quality is a well-recognized predictor of physical and mental health, wellness, and overall vitality. A person is said to be at its peak of his or her vitality when they are on top of things, efficiently combining their self-care, family, and social responsibilities, yet they are healthy and capable and still energetic. Only then can one function at optimal when sleep is of good quality. Marami pong definition kung ano ang tulog. There are some that say that it is a neurological state, an intermediate state between wakefulness and death. Pero simplehan po natin, it is reversible. It is a reversible state of perceptual disengagement and unresponsiveness to the environment. Ano po ba ang characteristic ng sleep? Technically, the characteristics of sleep encompass all living beings. Activity is reduced, stimuli response is decreased, it is reversible, recurrent, paulit-ulit, at spontaneous. Hindi siya napipilit. In humans, the typical posture is recumbent, nakahiga po, mostly on our back, and the eyes are closed, nakapikit po tayo. It is different from other species where they are upright and their eyes are open. Example po nito yung mga kabayo, zebras, elephant, because standing in their sleep allows them to escape predators even during sleep. So ano po ba ang functions ng pagtulog? Una po sa lahat, sleep is restorative. It is the most accepted explanation for why we sleep. Sleep restores tissues and prepares our bodies for the next day. This may involve cleaning accumulated neurotransmitters, yung mga chemicals po natin sa brain, as well as other tissue repairs that occur all throughout the body. Pangalawa po is energy conservation. We sleep to conserve energy. So, in a sense, we are able to spend our time functioning at a lower metabolism. Excuse me. Our overall caloric needs are reduced. So, example, awake tayo the whole time, kain ng kain, we may not have enough food to survive. So, it allows time to create glycogen also, which is an energy store that is used by the brain as a fuel. Pangatlo po is to regulate immune function. Specifically, yung cytokines, these are a type of protein that act as primary messengers ng immune system. They send signals throughout the body to orchestrate immune responses. They turn on or turn off defense systems and promote also different stages ng sleep. So they are produced during sleep, and during sleep, it is crucial for us to get shut-eye, especially when we are sick. Pang-apat po is memory consolidation. So basically, when we encounter or experience something important, an area of our brain called the hippocampus becomes active and works to hold that event in your short-term memory. So in order for those short-term memories to become long-term at hindi mo na sila agad malilimutan, the brain needs to consolidate the information and store it outside of the hippocampus. So when we sleep, our brain downscales the unimportant activity, irrelevant synapses, and upscales or increases activity of those important synapses. Maalala ko po ito nung college po ako. Madalas tinatanong ng mga kaklase kasi yung mga nagpuyat para mag-review, mas hindi nakasagot kumpara dun sa mga maganda ang tulog. Ito po ay dahil sa memory consolidation. Number 5, without healthy sleep, including both the NREM and REM stages po ng pagtulog, negative emotional reactivity seems to be significantly enhanced. So, dito po tulad po nung sinabi ni Professor, lokohin mo na ang laseng, wag lang ang bagong gising. This is because The positive reactions to positive events are often increased when we lack sleep. Lastly is protective. Ongoing sleep deficiency, yung kakulangan po sa pagtulog, is linked to an increased risk of heart disease, kidney disease, high blood pressure, diabetes, and stroke. Sa ibang species, yung safety, dun sa mga nag-hibernate, hindi sila nakikita ng ibang predators. Ano ba ang stages po ng sleep? 2 states. Meron pong 2 states ang pagtulog. Yun po ay ang REM at saka NREM. REM, ibig sabihin, rapid eye movement stage, at saka NREM, non-rapid eye movement stage. So, yung sa libro po, ang NREM ay nahati po sa 3. Dati po 4. So, stage N1, N2, N3, and N4. Ngayon po, na isama na po yung N3 at N4, these are the deeper stages of sleep. Sa libro, ang N3 na stage mas associated sa dreams natin na in accordance to reality. Halimbawa po na naginip kayo na gigising sa umaga, papasok, sasakay sa jeep, papasok sa opisina. Yung REM na mga panaginip po, ayon sa libro natin, associated sa mga panaginip na bizarre. Tatalon ng bundok, 3 bundok, nakikipaglaban sa war, mga ganun po. Ito po ay isang hypnogram. A hypnogram is a graphical presentation of the sleep stages. So, normal sleep progresses in a series of 4 or 5 sleep cycles. Ngayon, ano po ba ang requirements para masarap ang tulog? The requirements for good sleep include, number 1, adequate amount of sleep. Number 2, correct timing of sleep. And number 3, good quality of sleep. So, how much sleep do we actually need? How much is enough sleep? The National Sleep Foundation is one of the pioneers for sleep science and sleep health. They recommend the following number of hours for individuals to sleep. So, as we see here in this chart, adults aged 18 to 64, malamang nandun po tayo sa age group na yon, are still advised to have 7 to 9 hours of sleep in a 24-hour period. However, let me remind you that quality supersedes quantity. And finally, for the sleep to be good, it has to occur at the right time. Pero ano po ba ang tamang oras? 9, 10, or 11? So to understand this, I will introduce you a little to the mechanisms that maintain our sleep-wake cycle. So our sleep-wake cycle consists roughly of 8 hours of nighttime sleep and 16 hours of daytime wakefulness. Gaya po ng lagi kong sinasabi, si Lord ginawa po tayong matulog sa gabi at gising sa umaga. Kasi sa umaga, nandun po yung araw. Sa gabi, nandun yung moon, mas dim siya. Pero sleep is controlled by 2 internal influences, which is sleep homeostasis and circadian rhythm. Okay? So circadian rhythm po is a system that describes our brain's natural sleep-wake schedule. Siya po yung ating internal clock. So this figure that we have here shows everyone that everyone experiences natural dips in alertness, medyo inaantok sa mga ibang oras, at increased wakefulness during certain times in a 24-hour period. It is also the circadian rhythm that dictates our natural bedtime and morning wake-up schedule. So once you get used to going to bed and wake up at the same time each morning, nag-a-adapt po yung brain natin sa schedule na to. Unfortunately, we live in a 24/7 world. For this, we don't have to look very far. We ourselves are examples, diba po? Kaya ngayon po uso yung tagline na sleep is for the weak. O kaya sometimes you also have the YOLO attitude, you only live once. May mga kaibigan nga po ako sinasabi na try not to spend too much time sleeping. Kasi when we die, we have more than enough time to sleep. That is why the trend today, we do everything today, even those that things that can be done tomorrow. So as a consequence, we lose sleep. However, knowing now how important sleep is and its benefits, maybe it's time if we ask ourselves, is it really worth losing sleep? Diyan na po papasok ang sleep medicine. Ang sleep medicine po ay isang relatively new dito po sa bansa natin na specialty. It is a medical specialty focused on optimizing health and diagnosing and treating sleep disorders and other sleep-related concerns. Meron po siyang iba-ibang scope. Ito po siya. So, isa-isahin po natin. Sleep-related breathing disorders. These are group of disorders characterized by abnormal respiration during sleep. Ang pinakasikat po sa grupong ito ay ang obstructive sleep apnea. Obstructive, ibig sabihin po may barado. Sleep, nangyayari siya pag natutulog. Apnea, there is cessation of breathing, tumitigil po huminga. Because it is when the muscles relax and block the upper airway. In the Philippines, it is known that it is approximated to be at 3.8 million Filipinos ang may OSA. Pangalawang grupo naman po ay yung central disorders of somnolence. This include yung mga lagi pong tulog ng tulog. So the most popular disorder in this classification is narcolepsy. Yun po yung may sudden bouts of sleep during the normal waking hours. Third group is the circadian rhythm disorders. These are a group of sleep disorders that are characterized by a maladaptive synchronization between a person's biological clock and the environmental 24-hour schedule. Most common po na nakikita natin nowadays are yung mga shift work disorder, yung mga kasamahan po natin sa BPO, kasi they work during non-traditional hours. Parasomnia is a sleep disorder that causes abnormal behavior during sleeping. They occur during any stage of sleep. Meron pong NREM-related at saka merong REM-related. NREM example po is yung confusional arousals. Yung mga anak po natin natutulog, tas biglang babangon na nakabuka yung mata, parang nagmamasid, pero pagka tinanong nyo po sa umaga, hindi naman po nila maalala. REM-related parasomnia, yung iba po, mga lolo't lola natin, habang natutulog, nire-reenact nila yung dreams nila. So, kung nasa World War II sila, minsan ang nagko-complain yung katabi po nila kasi nabubugbog sila paggabi. Sleep-related movement disorders, these involve physical movements which may be irresistible or involuntary. They occur during sleep or kahit pag periods of rest na. Kaya mas madalas they create insomnia at saka daytime fatigue sa ating patients. Pinakasikat po sa grupo na to ay yung restless leg syndrome, which is characterized by unpleasant sensation deep inside the legs. Insomnia po actually is the most common sleep disorder. Lahat po tayo malamang one time in our lives naka-experience na po isa sa mga type nito. This can be acute, where it occurs for less than 3 months, and chronic if more than that. So individuals who complain of insomnia reported to have repeated difficulty of initiating sleep, hindi makatulog, sleep onset insomnia, or remaining asleep, hindi ma-maintain yung tulog, or masyadong maagang magising compared to the usual, despite the adequate opportunity and condition and time for sleep. So, kapag kulang po ang tulog, it results in sleep deprivation. Ano po ba ang sleep deprivation? So, this term describes a state caused by inadequate quantity or quality of sleep which may be voluntary or involuntary. It is acute when sleep is curtailed for one or few nights and wake periods extend about 16 to 18 hours, whereas chronic sleep deprivation occurs through repeated sleep restriction. Acute, halimbawa, duty ka, hindi ka matutulog buong gabi, pero bukas pwede ka nang matulog. Chronic, yung mga patients na nililimitahan yung tulog gabi-gabi para ma-fulfill yung social family obligations. So, causes nito, tulad nung na-discuss po kanina, una ay sleep disorders, yung mga sleep apnea, insomnia, and the like. Pangalawa, aging. People older than 65 years old have trouble sleeping because of aging, perhaps because of the medicines they are taking or other health problems that they have. Illnesses, marami po tayong psychiatric problems that cause sleep deprivation. Iba pang sakit na pwedeng mag-cause nito, chronic pain syndrome, our patients with cancers, yung mga stroke, yung mga may Alzheimer's disease. Other reasons, including po stress, pwede pong hindi kayo makatulog pag very stressed kayo. May changes in schedule, panggabi ka, tapos ngayon pang umaga ka na agad, kailangan pang mag-adjust. Or kahit pagkakaroon ng bagong baby, pwedeng ma-disrupt yung usual na sleep schedule niyo po. Yung mga anak po natin, our children, mga pamangkin natin, are not exempted from sleep deprivation. Actually, inadequate total sleep time is the greatest challenge that we have sa mga bata. So, families tend to underestimate children's sleep need, and lack understanding of the relationship between inadequate sleep, behavioral and health, and even neurocognitive problems. So ngayon po, na-appreciate ko nung araw na pinapatulog ako nung lola ko sa hapon. Our children are exposed to the developments in technology. This gave them an increasing number of stimulation-seeking behaviors. They have access to movies, video games, social media, pwede yan kahit 24 hours a day, 7 days a week. Pangalawa, yung online classes na nauso, pamula po nung pandemic, has exposed our children to the white screen more than the allowable period during pandemic. Other causes of sleep deprivation, yung mga wake-promoting agents natin. Ang galing-galing po ng advertising, media, they have normalized consumption of wake-promoting agents tulad ng caffeine, mga ginseng, taurine, na nasa energy drinks. And these are increasingly utilized by children and adolescents to fend off their sleep. So, hindi lang tooth decay ang kalaban natin pagka mga ganito, but also obesity. It will all the more predispose them to experience insomnia, nervousness, irritability, and even an upset stomach. So, our children are also stressed. Nasa stress din po sila. So, they may become sleep deprived due to emotional factors such as stress, anxiety, and mood disorders din po. So, studies show that kids with ADHD are 4 times more likely to fall asleep quickly and stay in bed all night. So, kapag hindi po adequate yung tulog, ano po yung consequences? Ang pinaka-prominent po sa sleep deprivation is cognitive impairment. Yung mga sabaw na naman si doktora, mga ganun sila kapag puyat. There is impaired behavior, alertness, and vigilant attention. May isa po akong pamangkin, hihingi siya ng baon kapag from duty kami. Kasi alam niya po na impaired yung alertness namin. So, another study, sleep deprivation deteriorated recollection of both neutral and positive stimuli. Kaya po mainit ang ulo kapag hindi po tayo nakakatulog. When sleep deprived, the recollection of negative items, not positive items, elicited larger response in the amygdala and in the occipital area than when sleep is obtained. Pangatlo po, it may result in a powerful drive for sleep. So pag puyat ka, mas malakas yung propensity mong matulog. So yun may not always be under the control of the individual. So, this drive allows for the sleep to intrude into wakefulness. Yung iba po habang nagdadrive, nakakatulog. Kahit for a few seconds, whenever there is lack of physical activity, katulad po ng driving. So, such lapses are referred to as microsleeps, which can result in serious or catastrophic consequences. So, during sleep deprivation, yung iba, yung halimbawa sa shift work or sa jet lag, sa mga may duty, sleep and wakefulness may become disconnected from their proper body temperature. So, kahit oras mo nang matulog, pag na-adjust yung tulog mo, more than the usual, hindi ka na makatulog agad kahit gustuhin mo pa. Such patients may be sleepy regardless of the prior quantity and quality of sleep. Excessive sleepiness is a common cause of car crashes and near misses and contribute to over half of all fatal truck crashes. So occupational errors are also more common among individuals with sleep insufficiency. Higit sa lahat, yung quality of life po natin naaapektuhan pag pangit po yung tulog. So, they cut back on activities that we enjoy, kaya we do not have enough energy also to perform activities. Ano pa po ang pinaka-importante? Yung short sleep duration associated po siya sa variety of adverse cardiovascular outcomes. Noong 2016, inilabas po ng American Heart Association na sleep restriction is a risk factor for adverse cardiometabolic profiles and outcomes. So, mas maigi po na magkaroon ng healthy sleep behavior para magkaroon ng better cardiac health. Alagaan po natin yung mga puso natin. Along with other efforts para makontrol po yung BP, cholesterol, blood glucose levels, and the like. So, ito po napapansin natin sa mga college students natin. Pag exam week, mas madami pong sinisipon, sumisinghot-singhot po sila sa klase kasi nagpupuyat po mag-aral. Chronic sleep loss is associated with increase in inflammatory markers sa katawan natin and also with immunodeficiency. Others, sa mga bata, sleep restriction may have negative metabolic consequences such as the risk of obesity. Acute and chronic sleep loss also causes impairment in attention. Hindi sila makapag-participate ng maigi sa klase. They have low vigilance and very slow reaction time. Many studies have demonstrated that sleep restriction impairs children's ability to respond quickly and accurately on neurophysiological measures of attention. Iba pa po, like adults, pag sa mga bata, sleep loss also impairs complex cognitive or executive function. Hindi na po nagiging maganda time management, decision making, organization, attention. Others, tulad nung sinabi ko po kanina na importance ng sleep, memory. So, sleep is known to be an active process that is crucial for organizing and retaining salient information that we encounter day to day. Disrupted sleep is associated with overall decline of academic functioning. Akala natin minsan slow yung mga anak natin, slow yung mga bata, pero madalas po yan. And also, the impact of the level of emotional reactivity is associated with sleep deprivation. So, the ability to regulate both positive and negative emotions and the ability to accurately assess emotional reactions in others is declined during sleep deprivation. So, ngayong alam na po natin lahat ng mga yon, how do we get a good night's sleep? Marami pong healthy practices and tips for creating a conducive sleep environment. Una, sleep only as much as needed to feel refreshed during the following day. Dahil po pag in-extend natin yung sleep, extending sleep will only lead to a fragmented and shallow sleep. Mas maganda po i-restrict natin yung time in bed para maging consolidated, buo at diretso yung ating pong tulog. It is also proper that we stick to a sleep schedule. So we go to bed and get up from bed at the same time each day. Workday man po yan or holiday, Saturday or Sunday. This will help your body's sleep-wake cycle become more regulated. Recommended din po na if you cannot sleep within 20 minutes ng pagkahiga niyo po, you should leave your bedroom and do something relaxing. Tulad po ng reading physical books or listening to music until you become tired so that it will enable you to sleep again. Pangatlo po, pay attention to what you eat and drink also. The most obvious effect of the stimulant, ang pinakasikat po ngayon is coffee is life, is that it can make it hard for you to fall asleep. So marami na pong studies na nagpapakita na yung caffeine can delay the timing of your body clock. Also, it will reduce your total sleep time. Caffeine also can reduce the amount of deep sleep that you enjoy. Ito po ang main culprit na isa sa mga problema natin ngayon. So, we should also say goodnight to our devices. Our smartphones are the main culprit sa mga sleep problems natin ngayon. So, it is best for us to put off our devices or take a break from them before bedtime. Regular exercise in the morning deepens sleep, and exercising in the evening is stimulating and may lead to a delay in sleep onset. So, make sure sa mga bata, make sure that bedtime and morning wake-up time is around the same each morning. The same time each morning. So, this includes weekdays and weekends. So, keeping our bedrooms cool, comfortable, and dark is helpful to encourage our children to sleep. So, the beds are for sleeping, not playing, not watching TV, not playing on tablets or devices. So, wala din pong drinks or food na caffeine containing late in the afternoon or in the evening. Wala din pong big meals right before bedtime. We should try relaxing activities in the evening to wind down. So, tulad ng warm bath or reading, ito po, mga good habits po yan. So, we keep bedtime activities for our children in the same order para po predictable na po yung tulog nila. So, make sure na short naman at saka enjoyable yung activity. If not, we seek consult for sleep behavioral assessment pagka po yung mga sleep hygiene practices na isinuggest po namin offer no difference. So, most importantly, make sleep a priority. Ngayon po, uso na nakalagay lahat sa to-do list. Ilagay nyo rin po yung pagtulog. But, don't make it the thing that you do only after everything else. Maganda nga po, i-plot nyo muna yung tulog, tapos i-plot nyo all other activities na kailangan nyo accomplish during daytime. Ang lagi ko pong sinasabi, Dok, ano ba ang gamot ng puyat? Tulog po ang gamot ng puyat, hindi po kape. So, there is no substitute for a good night's sleep. If you become sleep deprived, you can eventually make up for lost sleep, but you can't do it in one night. Hindi po lahat mababawi yung sleep debt o yung utang sa pagtulog sa isang gabi. Most of the time, catch up happens gradually over a few nights. And if you have long-term symptoms of sleep deprivation or you suffer from frequent insomnia, it is best to talk to your doctor. In the year 2002 po, a conscious effort was made to gather like-minded physicians from different specialties to consolidate the forces of sleep medicine. So, at present, 83 po kami. We are 83 strong sleep fellows that are also fellows of other medical societies that are able to cater to your sleep needs. So with that, I hope I have dealt with all the objectives we have this morning. Thank you very much for your kind attention.
Hello, there you go. Thank you very much, Dr. Beverly, for that very informative, insightful decision. Medyo ang dami nag-react dito kanina habang nakikinig sa inyo po. So natutunan natin ang importansya ng pagtulog at napakarami pala nating pwedeng gawin na strategy upang mapabuti ang kalidad ng ating pagtulog. So I am sure her presentation we witnessed today is enlightening and empowering. So all right, let's give her another warm round of applause. Yung mga questions natin, be ready po for later. So now let me call on representative from UP Siesta to share with us their insights for Dr. Carbonell's talk. So we have Ms. Evie Crisel Oxales, a sophomore student of the Bachelor of Arts in Multimedia Studies program at the University of Open University. So from 2022 to 2023, she served as a volunteer on the communication Since 2023, she has been a commissioner of the Creatives and Publicity Committee at the UP Office of the Student Regent. She currently serves as the inaugural associate editor of the Cursor, UPOU official student publication, having previously served as the content director under the Provisional Editorial Board. So she is also a founding member of UP Siesta, joining shortly before the organization was recently accredited. So Miss Evie, the floor is yours. Saan siya? There.
Hi, good morning po. Am I audible?
Yes po, rinig po, rinig po.
Okay, so good morning everyone. I would like to thank Dr. Carbonell for sharing her expertise with the UPOU community and the Faculty of Management and Development Studies for giving me the opportunities to share my thoughts on the lecture. So most of the UP Siesta members are night owls, and based on the data collected during the application process, karamihan sila ay mga 4 to 6 hours lang ang tulog. Madalas po kasi ang pagpupuyat ng mga student dahil sa paggawa ng assignment para may pasa natin on time. So there's this fear embedded in our mind na baka malate sa deadline, despite some of us students making a to-do list. Like tulad ng ginagawa ko na meron akong tracker dedicated for taking notes of deadlines sa mga tasks. And I think ayun nga, tulad nung nabanggit ni Dr. Cabana, dapat idagdag na rin yung sa sleep schedule para makabawi man lang sa tulog after we do so. Kasi these days, kapag kinulang sa tulog at night, ang ginawang pambawi ay power naps during the day, since yet nawawalan kasi tayo ng focus sa work natin kapag napapagod, presumably due to the lack of sleep. So when I interviewed applicants sa UP Siesta, isa sa mga natanong ko sa kanila ay, have you ever had a dream that strongly affected your emotions upon waking? Unfortunately, most of what the applicants I've interviewed shared were rather traumatic experiences. So I even though some of these experiences were dated, parang naalala pa rin nilang lahat ng yon, and it's often troubling them even up to this day. So as an organization dedicated to promoting good sleeping habits, we hope to share the knowledge we gain from Dr. Carbonell's discussion, not only to fellow members but to the whole UPOU community. That's all from me. Thank you pa.
Thank you so much, Miss Evie. Maraming salamat po sa inyong makabuluhan na insight. For the UPOU students watching right now, you may want to consider joining UP Siesta. So ayun, I hope our audience has their questions ready, ating mga kababayan at ating mga taga-UPOU ngayon. As we are to begin the open forum, so Dr. Beverly, may we ask you to please turn on your camera for this part of the program. So again, for our on-site participants, you may submit your questions to our facilitators wearing maroon, or you may raise your hand, introduce yourself, and address your questions to our speakers. For our online viewers, you may also introduce yourself and post your questions on your streaming platforms, comments, or chat box, and we will address them to our speakers. So actually, meron po akong isang katanungan dito na from
Yes
So
po.
I noticed, ito po yung katanong niya. I noticed that the days prior to my menstruation, I find it difficult to sleep daw. So what does this mean? Maraming salamat po, Doc.
Marami pong factors na nakakaapekto ng tulog, including po yung mga hormones natin, especially sa females. Pre- and post-menstruation, kasama po yan. Ano po ang gagawin natin para ma-counteract yung mga effect na to? Good sleep hygiene pa rin po. The hormones naturally increase or decrease depende po kung anong phase nandun po tayo sa ating menstrual cycle. So, a good sleep practice, a good sleep habit, hindi pa rin po yan matatalo para makombat yung effects nung problems brought about by hormonal imbalances.
Hello? Ayun, there you go.
Yan po.
Thank you po. Thank you po, Doc. May tatlo po tayong katanungan na nagmula po kay Dr. Fina Flor Thailand. Una po ay, ang power naps po ba, Doc, ay effective? If they are, how long should this be? Yun po yung unang katanungan, Doc.
Okay po. Thank you po, Dr. Rafina. Actually po, yes, power naps are effective. They give us a temporary boost ng energy at saka nagiging mas well-rested po tayo. Ideally, nasa 15 to 20 minutes po ang power nap. Just enough to energize us. Bakit po? May mga patients, Dok, pa-power nap ako 3 hours sa hapon, pero hindi na ako makatulog sa gabi. Kasi po nakukumpleto nyo na yung sleep cycle. So, minsan kapag humahaba po yung power nap natin, nagigising na tayo dun sa deep sleep, pagising natin masakit na yung ulo. Kasi, nadidisrupt na yung normal na cycle ng tulog natin. So, 15 to 20 minutes power nap is okay po.
Ayun, akala ko po mga 3 hours nga po. Thank you, Doc. Ang po na katanungan, Dr. Thailand po is, how many hours in a day or night should children and adults sleep po?
Apa. Tulad po ng pinakita ko kanina, it is a good gauge po nung sleep natin. Children, actually, nasa 10 to 13 hours. Adults, average, minimum po 6 hours. Maximum is 8 to 9. Optimum po is still 7 hours per night. 7 to 8 hours per night. Yun. Yun po.
Thank you po, Doc. And then lastly po, do we have pillows or bed or similar items that enhance our sleep po?
Yes, opo. Meron po. It will depend upon the person kasi may mga tao po na side sleeper, mas komportable po matulog during sleep. Meron po tayong mga orthopedic pillows na magagamit na hindi naman po masastrain yung cervical area natin, yung neck natin. Although dun sa patients po natin na may sleep disorders, yung mga may OSA, obstructive sleep apnea, minsan po nagtataas sila or nagdadagdag po ng unan. Kasi pagka masyadong mababa naman, feeling po ng patients nalulunod sila, hindi makahinga. Nakalimutan ko pong idagdag yung kanina sa number of hours of sleep. Importante po na makompleto natin yung number of hours of sleeping. Pero tulad po ng sinabi ko kanina, mas importante po yung quality kesa po sa quantity.
Oo nga, Doc. Doc, napaka-active po ng mga Zoomers natin ngayon. May isa pa pong katanungan galing sa Zoom. Totoo po ba na di nababawi ang tulog? So yung tulog kagabi ay yun na yun? Yung tulog today ay for today? Tama daw po ba, Doc? Parang pati sa pagtulog may utang ah.
Actually, meron po, may tinatawag tayong sleep debt, sleep utang. Yung
Apo.
kapag hindi po natin nakukumpleto yung tulog natin. Ang computation kasi dyan nasa 24-hour cycle.
Mm.
So ideally, sa 24 hours po, meron tayong 6 to 8, 6 to 9 hours of sleeping. Pag hindi mo na kompleto or hindi quality yung tulog mo, hindi mo na feel na well rested, kaya hindi ka busog sa tulog, nagkakaroon po tayo ng sleep debt, yung utang.
Mm.
Nababawi po yun, pero hindi agad-agad. Depende po sa, may genetic predisposition din, sabi sa libro. Although, other books would also say na mababawi in 2 to 3 days time. So, dun sa mga patients na chronically sleep deprived, yung mga doktor natin, mga nasa BPO na night shift, binabawi nila yung tulog during weekends or off days. Um, Hindi naman po pwede na baunin kasi yung tulog. So parang pagpuyat ka the whole week, tulog ka the buong weekend. Hindi naman po pwede yun. So mag incorporate po tayo ng good sleep hygiene practices pa rin para makombat po yung effects ng sleep deprivation sa mga ganong pasyente.
Mm. Thank you, Doc. Doc, another from Irish Nicole Dumlao. Good morning daw po, Doc. How
Good morning.
long should we wait before we can lie down, sleep, after our dinner or last meal? Tanong ko nga rin sana, Doc. Bang humiga
Opo.
agad?
Yes,
Apo.
ma'am. Ideally po, nasa 3 hours bago po hihiga.
3
After we had our
hours.
dinner. Opo, yung
Ay,
mga nanay natin, lola,
sarap pa.
sasabihin,
Sarap.
nanonood pa ako ng
Ang dami po
teleserye.
nag-react dito, Doc.
Bakit? Kasi po pag sobrang busog, hirap ka ding makatulog. Pangalawa, there are other disease entities that may that na pwede kang magkaroon kapag ka nahiga ka agad. The most common na nakikita po namin as ENTs is still laryngopharyngeal reflux. Hindi pa po natunaw yung food mo, humiga ka na. So the probability of it na nagre-regurg, so makikita namin sa clinic na paos, ubo ng ubo, pero non-infectious naman. Yun po, laryngopharyngeal refluxes.
Yes, Doc. So, another question from Dr. Fina Flor, Thailand. Totoo bang habang tumatanda, mas umiikse ang tulog po?
Lagi po yung tanong actually per sa lahat ng lecture. Sa scientifically, hindi po. Pero actually yung quality, yung amount ng REM sleep nila, yung deep sleep, yun po ang umiiksi. Pangalawa, kapag yung mga elders po natin, hindi multifactorial na siya. Yung iba po maraming maintenance, yung ibang maintenance ibibigay sa gabi pero wake promoting siya. So minsan hindi makatulog. Dok, hindi ako makatulog. Kasi yung gamot na to. Yung iba inaantok sa umaga kasi yung iba nakaka-induce ng tulog. Yun ang mga gamot, mga ganun po.
Yes nga, Doc. Opo. So, para katanungan po kay Miss Evie,
Apo.
what does UP siesta do po? Para kay Miss Evie, ang ating, andyan pa po kayo.
In UP
Ayun.
Siesta, besides educational discussions, meron po kaming mga activities like siesta hours where members gather synchronously to virtual platforms like Discord or Zoom and fall asleep. Something like sleep calls. So parang sabay-sabay kami matutulog while maybe some are doing activities in the afternoon. And then we also organize meetings with fellow members to share our knowledge on sleep and our sleeping habits.
Thank you, Miss Evie. Kaya pala. So, yung pala yun. Kay Doc ulit, dalawang katanungan from Anon, yung participants natin. Why is sleep intermittent po and how can I resolve? Why is my sleep intermittent po? And how can I resolve this? Paputol-putol daw, Doc.
Salamat po dun sa query na yan. Although, mas ma-evaluate, sir, kapag na malalaman ko kung bakit siya intermittent. Kapag nakita ka ng specialist na nabigyan ka ng thorough sleep history taking at saka physical examination. I'm sure na hindi ka masyadong busog sa pagtulog dahil intermittent siya. Kasi actually, isa sa qualities of requirements for good sleep is yung diretso na tulog at saka yung busog na tulog. So, how do you combat it? Number one, first, you should know what causes your intermittent sleep. Bakit siya putol-putol? If you are pagka hindi mas maganda seek consult para malaman, para ma-address ng tama yung rason kung bakit paputol-putol ang tulog niyo po.
Mm-mm. Doc, another from Anon. For Alzheimer's patients who are experiencing sleep problems at night, would you recommend that they take melatonin tablets? I think kahit kami pong ordinaryong mamamayan, do we drink melatonin tablets po?
First and foremost po, na treatment ng poor sleep is good sleep hygiene. Number two, melatonin, actually, isa siya sa pinakasikat and commonly used and abused na gamot po para sa pagtulog. Pero let us remind you as sleep specialists that melatonin is not a sleeping pill. It is a chronobiotic. Ibig sabihin po, if used in hindi appropriate na timing and hindi appropriate na amounts, mas masisira niya po yung cycle, yung circadian rhythm ninyo. So, ano pa po yung isang tanong? Yung sa mga Alzheimer's patients po
Apa.
natin, our elderlies, a thorough sleep history should be done para po ma-evaluate din lahat ng gamot nila para yung proper na gamot po ang maibigay para matulungan silang matulog. Kasi sa other end po ng spectrum, yung mga Alzheimer's na patients, our patients with Alzheimer's, yung iba nakakalimutan na ring matulog. Ganun pong point. So may proper po na mga gamot and sleep hygiene practices para sa mga patients natin.
Thank you, Doc. From Josia Santa Maria, Doc, mukhang ano siya. Is there a way to correct my sleep pattern? I work graveyard shifts po, Doc.
Opo. Tulad po ng sinabi ko sa kanina, Ma'am Jody, thank you po for that query. Isa po sa pinaka-common na sleep problem na encounter natin is yung shift work disorders na marami po ngayon. So, ang pinakamaganda po, number one, let us know your sleeping pattern. Gaano po kadalas mag-shift? Ano po yung pattern ng shifting? Yung palate ba siya ng palate or biglang aaga siya? Ideally, for patients who work graveyard shift, nasisira yung sleep pattern kasi during the day, you have to address your social and family obligations. Tama po. Imbis na gising po kayo the whole night pag graveyard shift, tas tulog sa umaga, gising pa rin sa umaga. Kasi aasikasuhin ng pamilya, mga anak, mga ganon. So if it's persistent, ideal po is magkaroon po ng 4 hours na staple na tulog doon sa ideal na sleep time ninyo. Tapos yung another 3 hours, hahanapin po natin depending on your sleep cycle na makikita po natin sa mga sleep diary. Mas makakatulong po para ma-evaluate yung tulog ninyo is for you to consult a sleep specialist para po ma-analyze natin yung pattern ng tulog nyo. Yung mga shift work kasi long term po yung iba na pattern ng shifting nila sa trabaho.
Thank you, Doc. So another question po from Daniel Aquino. What advice can you give to someone undergoing postpartum who is also taking her medication for chronic insomnia?
Okay. Thank you po, Sir Daniel. The sleep specialists are closely working with other specialties like our psychiatrists who are better equipped and better adept at treating patients with other diseases, katulad po ng postpartum depressions. Pangalawa, aaralin po kasi din namin lahat ng gamot na tinitake in ng patient kasi baka may nag-i-interact. And we also give cognitive behavioral therapy to patients who have chronic insomnia. Sa ngayon, to date, we also have 2 sleep psych specialists in the country na whose services you can also avail.
Okay na.
Yan po.
Thank you, Doc.
Apo.
Thank you po, Doc. There's another question. Okay. Sige, Ma'am Noreen, take it over.
So, Doc Beverly, very curious lang po dun sa minimension nyo na about sa sleep history. So, I think very kailangan nating tingnan yung practical side. So, if a person is really serious about knowing bakit meron siyang mga sleep disorder, so ano po yung mga ano nito, like cost and then the test to be done. So, maybe you can share it with us po.
Okay po. Apo. So, practical things to be done. Number one is gamitin po natin yung sleep hygiene techniques. Yun po yung latter part ng lecture na sinabi ko po kanina. Actually, when you Google, when you check the net, ang dami po, ang dami din sa YouTube, mga mindfulness relaxation techniques para ma-employ, para makatulog. Now, if all else fails na ginawa nyo po yung sleep hygiene practices, it is best to consult a sleep physician. Hindi po kasi iisa lang, hindi lang insomnia, hindi lang hilik, hindi lang pagtigil paghinga pag natutulog ang meron. Pwede pong the sleep disorders can occur one over the other. So for us to for your sleep problem to be properly evaluated, maigi po na to consult a sleep specialist. Now, not all patients nag-undergo ng sleep study. It will depend upon the sleep disorder that you have. Siyempre, kapag hindi ka makatulog, paano ka isi-sleep study? Parang ganon. So, iba-iba din, kung baga, iba-ibang laboratory din ang gagawin. Ang most common po na parang laboratory ng tulog is the sleep study. We often employ it for patients who have difficulty breathing when they are asleep, na yun po yung may OSA, obstructive sleep apnea. We have accredited laboratories all over the country. It will depend upon the institution po na meron. Tsaka depende din po sa test na kailangan as deemed needed by your sleep physician.
Thank you, Doc. Doc, ito, next question ulit from Anon. Medyo nakarelate ako dito. Tips for someone who experiences intermittent sleep po. Kasi recently, I've been waking up consistently around 3 to 3:15 a.m. without the aid of my alarm clock. Usually nga 3 nga, Doc. Ay, oo
Yan
nga
ang-
daw from here, Doc, sa on-site.
Opo. Kung ako po, tatanungin ko, anong oras po ba kayo natutulog? Magkaiba po yung what time did you hit the bed, anong oras ka po humihiga, at saka anong oras po kayo nakakatulog. Kasi isa po sa pwedeng rason kung bakit intermittent yung tulog is you do all other activities in bed. Well, in fact, the bed should only be used for sleeping. Madalas, makakatulog maiksi, tapos may gagawin ulit, makakatulog ulit ng maiksi, may gagawin ulit. So, ideally, yung sleep should be consolidated. So, gawin po muna lahat ng activities outside the bed. And when you are sleepy, that is the only time po nahihiga. It is also a part of the cognitive behavioral therapy, yung mindfulness na tinatawag natin. Kailangan na ma-adapt ng brain natin na kapag nakita yung bed, inaantok. So kung nagla-laptop ka sa bed, nanonood ka ng Netflix sa bed, cellphone, Facebook, exposed ka sa white light, hindi ka makakatulog, tapos pag napagod, makakatulog, pero disrupted na yung sleep cycles mo.
Oo nga, Doc. Tama po. So, another question from Anon ulit, Doc. Does the amount of food that we eat during dinner affect our quality of sleep? Ano po yung mga recommended food for dinner? I think heavy ba? Light? Or ano? Tingin ko yun po yung question ni Anon.
Okay. Our books would always say na low carb. Practically, pag sobrang busog po kayo, hirap po matulog, di makahinga, di ba po? Parang bloated na bloated yung tiyan. Pag gutom din po, hindi rin makatulog kasi syempre gutom po kayo. That also applies for our fluid intake. Pag masyado pong madaming nainom, kahit po antok na antok kayo, pag puno yung pantog nyo, gigising po kayo para umihi. So it is but proper na magkaroon po ng well-balanced na meal, Low carb ang pinaka-advisable po sa books natin bago matulog. Low fluid intake, all caffeine intake should be, lalo na sa mga patients natin with sleep problems, earlier than 2 p.m.
Mm. Doc, from Carissa Rose Ostonal, may you recommend po centers, clinics, or doctors whom we can consult with regarding potential sleep disorders and how to address them? Normally po ba nako-cover ng health insurances yung ganitong consultations? Thank you.
Yes. You can, we have a website, the Philippine Society of Sleep Medicine, and also we have a Facebook page. Although hindi ganon ka-updated yung website namin, mas updated sa Facebook. We already have 83 strong fellows distributed all over the country. Also, our sleep labs are also available. For coverage of insurances, it would depend upon the premium of the insurance. Ang experience ko po.
Okay. Thank you, Doc. Maraming salamat po. Another question, this is funny po. What's your take on the Filipino belief superstition that kung hindi makatulog ang isang tao, may curse or multo sa kwarto?
Sa
Di ba
totoo lang po,
Dinig ko.
marami po akong patients na ganyan. Sabi nila may nagbabantay sa kwarto kaya hindi makatulog, may mga ganun po. Ah, Naniniwala po ako na a good sleep hygiene practice will always benefit the patient. Other patients, pagka may mga patients na hyperarousal bago matulog, may hyperarousal bago matulog. Isip po ng isip. Makakatulong din kapag ni-rearrange nila yung furniture, inayos nila yung kama at a more comfortable way, or yung iba lilipat ng room kasi may associated na trauma sa room na to or sa house na to. Malaki pong tulong yun para ma-relieve din po yung stress nila na associated madalas na sa pagtulog.
Hello? Ayun. Yes nga, Doc. So kung from Anon ulit, Doc, bumalik siya sa pills. When should one resort to sleeping pills po, Doc? And then what is your take on the use of melatonin food supplements?
Okay.
Last 3 question na po pala tayo, Doc.
Okay, thank you po. The main treatment for insomnia is cognitive behavioral therapy. Yun po is yung sleep hygiene, good sleep hygiene practices. It is further evaluated by sleep physicians at ngayon masaya po kami sa sleep dahil meron na po kaming 2 sleep psych physicians na mas expert po kapag may kaakibat na psychiatric problem. The sleeping pills are reserved as an adjunct, tulong lang po dun sa mga cognitive behavioral therapy nila. The melatonin supplements are very popular actually nowadays, especially because you can get it readily over the counter, yung iba infused with melatonin, chuva, mga ganun po. Pero tulad po ng sinasabi ko, it is a chronobiotic. If given at the wrong time and the wrong amount, it can disrupt your circadian rhythm. So what is best is first alamin muna yung problema, tapos how to address it. Madalas po kasi yung mga common na problems na nakikita natin sa sleep, very practical yung mga approaches. Kasi, di ba po, sinasantabi natin yung tulog. The mere fact na nagsa-cellphone tayo bago matulog, mas maganda na i-off muna siya, you wind down prior to sleep, tapos hit the bed when you are sleepy. May ganun po.
Thank you, Doc. Ang ating mga kababaihan dito ay nag-react talaga. So, another question po from anonymous participant. Considered po ba na mas good quality ang night sleep than morning sleep?
Yes. Yes, ma'am. As humans, we were made to sleep during the night and wake up kaya yung si araw nasa umaga. Pero nga po, in our attempt to make things better for ourselves and for the world na naging 24 hours, 24/7 cycle na kailangan nating mag-adapt. We also encounter the sleep problems. Pero as much as possible, na makakatulog po kayo sa gabi, na diretso, mas magiging mas busog po yung tulog ninyo.
Thank you, Doc. So last question po from Arian. Does sleep deprivation cause a delay in the menstruation cycle po?
There are numerous studies about that, pero wala pa pong clear-cut association between the two. One can lead to the other because of the hormonal imbalances a woman encounters during her menstrual period.
Thank you so much, Doc. Okay, once again, let's all give a warm round of applause to our speaker, Dr. Beverly Carbonell, and to Miss Evie from UPOU Siesta. So we have very interesting questions that keep on coming, but unfortunately, we would need to cut short the open forum in the interest of time. So at this point, may we call on Dean Joanne Serrano and Dr. Myra D. Oruga to award the certificates and tokens of appreciation to our speaker. So allow me to read the citation. The University of the Philippines Open University, Faculty of Management and Development Studies, in partnership with UPOU Siesta, awards this certificate of appreciation to Dr. Beverly P. Carbonell for serving as resource person in the Let's Talk It Over series titled Gusto Kong Matulog Pero Di Ko Magawa, The Importance of Sleep for a Person's Health and Well-Being, held on July 31, 2024 at the UP Open University, Los Baños, Laguna. Given this 31st day of July 2020, applause to our speaker. Thank you very much, Dr. Serrano, and to our speaker. To formally close the program, we will be hearing live from Dr. Myra Oruga, our Program Chair of Diploma in and Master of International Health. So, Doc Mai, may we invite you for our closing remarks po?
I'll make it quick. Thank you, Bevs.
Salamat po.
Beverly is my mentee in thesis. When she first submitted to me her proposal, sabi ko, nang weird naman ito. Bakit sleep? Now, I appreciate it more kasi I'm sleep deprived also. But there are other reasons why. And when Doc Joanne asked me, May, kailangan natin ng topic about sleep kasi kulang ako sa tulog eh. I immediately contacted Dr. Beverly. Okay, so the importance of sleep for a person's health and well-being cannot be overstated. Quality sleep is essential for physical health, mental clarity, emotional stability, and overall quality of life. It supports immune function, heart health, and weight management while enhancing cognitive performance, mood regulation, and stress resilience, just like what Dr. Beverly have said to us. By prioritizing good sleep hygiene and making restful sleep a consistent part of our daily routine, we can unlock a myriad of health benefits, promote longevity, and enhance our overall well-being. Let us recognize sleep as a fundamental pillar of a healthy lifestyle, just what we are always stressing, and commit to nurturing it for a healthier, happier life. In behalf of Dr. Joanne Serrano, our Dean of the Faculty of Management and Development Studies, our program, the Diploma in Master of International Health Program, this is our commitment to our stakeholders to promote health and well-being sa inyo pong lahat. We will have another, let's talk it over. Okay, this was just conceptualized kanina. Papayat din ako, tiwala lang. Balik Alindog program. So we have a good pool of faculty in our program. So hopefully he will accept the in-announce ko, baka naka-online si Dr. Eric Mendoza. He's a very good internist, endocrinologist, and nutritionist, weight management specialist. So, abangan nyo na lang po by August. Okay po, August.
So maraming salamat po sa inyong pagdalo ngayong umaga. Okay, thank you.
Actually, Doc, na-challenge yun na ako, diba? Parang next dapat na hosting, medyo lumayat na. Medyo mahirap tong, mahirap pala mag-host. So, thank you, Dr. Myra, and that concludes our program on behalf of the FMDS. We thank all of you who joined us live and virtually today. Before we leave, may we request everyone to answer our short event evaluation form, which you for a person's health and well-being. Maraming salamat po.